The government's scientific advisers have warned that people will need to avoid unnecessary social contact for the best part of a year, alternating between strict and less strict measures to help intensive care units cope. It's in marked contrast to the Prime Minister's assessment yesterday that the UK could turn the tide of the disease in 12 weeks. Here's our medical correspondent Fergus Walsh.
Intensive care units are overwhelmed in Italy. There have been more than 600 deaths there in the past 24 hours alone. The only way to avoid that here, say government scientists, is to keep our strict social distancing controls in place for at least 6 of the next 12 months. That includes school closures, household isolation, and stopping all unnecessary social contact. The scientists are trying to prevent one huge peak of cases of COVID-19, which would overwhelm NHS intensive care units. Instead, there'd be a series of smaller peaks spread out throughout a year. To achieve this, they would suppress and then release the virus by turning the social distancing measures on and off like a tap to control the flow of patients into intensive care. They predict a 2 to 3 week delay between measures being put into place and their impact being felt in intensive care. The scientists estimate that 2% of those aged under 50 who get infected will need to be admitted to hospital, rising to 44% among the over 80s. Warmer weather reduces flu cases, but the science is unclear whether the coronavirus outbreak will subside in summer. The fatality rate for COVID-19 is very age-dependent, varying from 0.01% or 1 in 10,000 among the under-20s, rising to 8% or 1 in 12 among the over-80s. A vaccine could save millions of lives globally. Public Health England scientists at Porton Down in Wiltshire are playing a key role, but it's unlikely to be ready for at least a year. Fergus Walsh, BBC News.
A major London hospital has become the first in the UK to announce that it had, for a time, run out of critical care capacity to treat coronavirus patients. Northwick Park Hospital declared a critical incident for 24 hours and contacted neighbouring hospitals about transferring patients. It comes as more than 65,000 former nurses and doctors in England, Wales and Scotland are being contacted about returning to work to help deal with coronavirus. Here's our health editor, Hugh Pym.
The critical incident was declared at Northwick Park Hospital late yesterday. Patients were diverted to other local hospitals. The reason given was increasing numbers of patients with coronavirus. In a message to staff, the trust which runs Northwick Park said, "This means that we currently do not have enough space for patients requiring critical care." The incident alert was stood down this afternoon, but it highlights the strain across the NHS in London, as one doctor at another hospital explained.
I guess if things get really bad, then there's the worry that intensive care beds will get completely full and further patients won't be able to be admitted or will have to make horrible decisions about who gets an intensive care bed and who doesn't, even though in normal circumstances we want to give them to everyone. And those can be really harrowing times.
The pressure was clear when a nurse after a long shift couldn't buy food and pleaded with shoppers not to empty the shelves in a widely watched social media clip.
There's people like me that are going to be looking after you when you're at your lowest. Just stop it, please.
England's chief nursing officer told me how sad she was to hear Dawn's story.
It's heartbreaking when you see nurses across the country working 48-hour shifts, week shifts. They're working so hard and they will be working even harder, I'm absolutely sure. But I'm asking for all supermarkets to open their doors for those that are working in health and social care, providing this expert care to our patients.
This cab firm in the East Midlands is offering free delivery of food to NHS staff, as well as those who are vulnerable. They say they made 300 deliveries in the last few days. A call's gone out to retired staff to come back to the NHS front line. Bridget worked for 38 years in the health service, mostly as a senior nurse, and is ready to return.
It's a scary prospect because we don't know enough about this disease at the moment, and I think there's a lot to be learned, but I think it's really important for me to go back in, and I think I just have to take it as it comes.
It's clear that NHS leaders are expecting immense pressure as case numbers surge. That's why they want to bring back retired staff. But many doctors and nurses are very concerned about what they're facing up to right now.
Today I'm doing P4, so this blue one.
And the work of staff was seen at first hand by the Duke and Duchess of Cambridge visiting an NHS 111 call centre, one part of the huge effort being made across the service. Hugh Pym, BBC News.
Schools across the UK closed their doors this afternoon with no clear idea of when they'll reopen. They'll be shut to all but vulnerable pupils and the children of key workers. There's also been more detail on how grades will be calculated for pupils whose exams have been cancelled, as our North of England correspondent Judith Moritz reports.
It's not even Easter, and this could be the last school drop-off of the year. For the children, it's bizarre. For their parents, facing weeks of home teaching, it's daunting.
Have a great day. It can bring tears to your eyes if you think too much, so you kind of just roll with the punches and just do what you can, really. It's going to be hard.
We've already looked through my 5-year-old's folder and there's lots of phonics, and I'm thinking, oh my God, phonics? What's phonics?
For children in Year 6, it's extra emotional. This could be their last day of primary school.
What will happen if we don't come back to school before we leave to Year 7?
We're not sure what's going to happen, but obviously here at St John's, we're a community.
Some children will now learn at home. Others whose parents are key workers like nurses or police officers will still go to school.
My dad's in the army and my mum's in charge of all the trucks that deliver food and that to shops.
So you're going to come to school, you think?
Just over 10% of the children here will be in school from next week.
We are providing a childcare service to make sure that our children are safe while their parents go about their really, really important and critical work to help the nation. And they'll be doing activities that look a little bit like school, but mainly it'll be things like board games, making sure that they're doing some of the work that they're set by their teachers.
School playgrounds will be a lot quieter and pupils at home will face restrictions.
Though the advice is to allow children to play outside, even go to the park for a kickabout, the instruction is also to stop them from playing too close to other people and to prevent them from crowding together with lots of friends for long periods.
For students in exam years, like these sixth formers in Bolton, there was news today that their grades will be awarded based on data including mock exams and teacher assessment.
It's not as big of a deal when you're doing your mocks as like the real things, and that, I think that's just like everyone thinks that way. So I think it's just the uncertainty of what's going to happen.
These Year 11s should have their leavers assembly in July, but their teachers brought it forwards, a small chance to celebrate amongst so much upheaval. Judith Moritz, BBC News, Greater Manchester.